Good afternoon, everyone. So I'm very much honored to share with you focused ultrasound ablation combined with endometrial ablation clinical study on the treatment of adenomyosis. First, some brief introduction of Hive Center. Department of FUAS and reasonable specialist talent, excellent and sufficient personal reserve with a total of 32 medical staff, including 13 physicians. We have over 3,000 HIFU treatments and almost 2,400 times of high-G treatment. And also we train HIFU masters. So based on the HIFU center's construction in many different departments and medical, nursing, and treatment, we have improved a lot in terms of its scientific research capacities. And these are the academic results or achievements by our study in terms of increasing the safety of the adenomyosis HIFU therapy. So, and also pregnancy outcome impacts of HIFU. Some benign tumor research, and based on these national key laboratories and the association, we have hosted a series of academic seminar and exchanges. So today I would like to share with you the current status of the treatment of adenomyosis. So adenomyosis is classified into two types: localized part and diffuse part, and also say the extragenous and the intragenous. According to the different types, there are different expression of the clinically. So improvement of menorrhea and dysmenorrhea is the things that we are considering the most. So according to the abnormal uterine bleeding, AUBA, according to the patients with AUBA, so we have also got some follow-up, and we find that in terms of dysmenorrhea, it improves a lot, and the outcome is satisfactory. So we give the patients with GnRH and Mirena as the supplementary solutions. And the recurrence rate, as one of our professors said, is a kind of anti-intervention rate. So we give one part of them the hysterectomy and also the repeated HIFU treatment and other interventional treatment. So we're thinking about, for this part of patients, how can we reduce the symptoms or recurrence rate of the menorrhagia or dysmenorrhea. So according to the path or roadmap of this treatment, the estrogen, GnRH or Mirena, so for these patients without fertility requirement, they have poor medical compliance, and how can we achieve the long-term management? So that leads to the next phase of our research, that is the selection of these patients into the interventional treatment. So AUB diagnosis and the treatment consensus. So AUB patients can choose HIFU treatment, and for this part of these patients, so we which type of economy we should choose. In fact, as academician said, we should master several solutions, several technologies, and we can try to select the ones with the minimal invasion to the patients. So with this thermal balloon technology, with the shorter time and the better results, and we can see that in this way we can reduce the menorrhagia or dysmenorrhea symptoms with the reduction rate of 80%. And with this thermal balloon technology can reduce the menstrual flow, and hopefully we can solve these problems. Last year, we applied a project and and supported by the National Ultrasound Association support. And so through this research and this program, and we hope that we can help the patients to improve their life quality through this solution with the combination of the HIMO treatments and HIFU treatment and the thermal balloon treatment. So 3 indicators for us to see the clinical symptoms. So we are focusing on the dysmenorrhea score and the menstrual flow score. So through these different scores, and we can have this general situation, including the size of the uterine and lesion size, and animal thickness, and some other HCG. And now the research is ongoing. But we have gained some initial data, and we can get some conclusions through this comparison. So from this experimental group, there is some reduction of the score, and more reduction for the experimental group, and some improvement in terms of dysmenorrhea. And because the pain score is around 3, so that is acceptable. And this is the case I would like to share with you, 45 years old. And this patient also used the relevant drug therapy, but the marina was removed. And we can see the pain score before is 18, and after that is of the menstrual volume 103. So with these oral pills, we can see that this is the check of the blood routine and tumor markers. So we can see that these patients actually are not that sensitive to those medicines. And this is the imaging examination. And you can see the pelvic contrast enhanced MRI. And it has a hyperecho T2 signal. And with this size, you may see from this slides of the uterine, a very clear diagnosis, adenomyosis and anemia. So with this drug therapy and Mirena, so the result is not good. Without the fertility requirement, we put this patient into the HIFU therapy, and 180 seconds of the treatment time, and the patient feel good. And the second day, we offered the thermal balloon technology to this patient, and the patient also feel good under the venous anesthesia. So after the 1 day after the operation, we can see that's the pelvic contrast. And 4 months after the operation, the re-examination of the ultrasound. So this is the shrinkage of the uterine volume, and the score goes from 8 to 5, and the reduction of some menstruation flow, and a half-month discharge of the fluid. And 8 months after the operation, the MRI examination. So you can see the nodule size. So compared to that in the before the operation, the volume of the uterine has been reduced. So we find that the HCG has been increased. And CA 1 to 5 back to normal, and the pain rate scores goes from 8 to 2. So the final goal for the doctor is to let the patients feel satisfactory after this therapy. So from this, we can see that focused ultrasound ablation surgery combined with the endometrial ablation has certain clinical efficacy and safety in the treatment of the endogenous adenomyosis. And we hope that through explore these clinical treatment options for patients with these technologies and alleviate the symptoms and improve the quality of life and reduce the recurrence rate of the patients.